external genitalia and internal genitalia. The vagina, uterus, uterine tube, fallopian tube are located in the internal part in the pelvic cavity, so they are internal genitalia, and the pudendum or the vulva are located in the external genitalia. The first, the ovary are the equivalent of the testes, which are located in the pelvic cavity. Ovary, like the testes, the first are originated in the posterior wall of the abdomen at the level of L1. Yes. And travel inferiorly to arrive to lateral wall of the pelvic cavity. And in the lateral wall, they stops their movements. As you know, the ovary has two parts. The surface of the ovary is named cortex, which cortex contains follicles. Yes. The depth of the ovary is named medulla, which medulla contains the vessels of the ovary. The anatomy of the ovary. We say that anatomy is located in the ovarian fossa. What is the limitation of the ovarian fossa? Look at here in this slide. It is posterior, it is anterior. In the anterior part we have bladder, okay? After bladder you can see uterus in this area. After uterus you can see uterine tube. Why? Come here. Thank you. Look at here. Anterior, posterior. In the anterior you can see the bladder. Posterior you can see rectum. Between these two structures we have the uterus. They are the uterine tube or fallopian tube, and they are the ovary. Okay, which are located in the ovarian fossa. But what is the limitation of the ovarian fossa? It is anterior and it was posterior, superior. Okay, the anterior limitation of ovarian fossa is made by obliterated umbilical artery. Obliterated umbilical artery. Okay? Yes, made a ligament. Which ligament?
Umbilical.
Which umbilical ligament?
Medial.
Yes, medial umbilical ligament. Yes. So it is anterior boundary of the ovarian fossa. Posterior boundary of the ovarian fossa is ureter, okay, and posterior to ureter we have vessel. Which vessel? Internal iliac artery. Yes. And posterior to the artery we have the internal iliac vein. It is posterior boundary of the ovarian fossa. What structure are located in the superior part? Look at here. In the superior part we have external iliac vessels. Yes? Yes. External iliac vessels are the superior boundary of the ovarian fossa. So, ovary is located in this area. Here we have the ovary. As you know, the ovary is like the testis. It has upper pole, okay? Here, upper pole, lower pole. It has two surfaces, medial surface and lateral surface, which lateral surface attached to lateral wall. It has two borders, anterior border and posterior border, okay? What are the adjacents of the ovary? The first was upper pole or superior pole. Look at here, upper pole is adjacent to this vessel. Upper pole is adjacent to external iliac vessel. Also, in the right side, if the vermiform appendix is positioned in the pelvic, it is the upper adjacent of the ovary in the right side. Okay? Another adjacent of the upper pole. Look at here, superior pole or upper pole. Look at this ligament here and also here. Okay? It is named suspensory ligament of ovary. Suspensory ligament of ovary, which I will talk about this ligament more in future. They are superior adjacent of the ovary. What are lateral adjacent or adjacency of the lateral surface? As you know, lateral surface attached to lateral wall of the pelvic, okay? But in this area, we have artery and nerve. Which artery and nerve? Obturator, okay? Obturator, artery and nerve. So that any cancer in the ovary, okay, any enlargement in the ovary made an impression in this nerve. What is the sign of the people? They have the pain, yes, pain, and sudden movement in the adductor part of the femur. Because obturator innervated the adductor compartment of the femur, okay? And they are lateral adjacent of the ovary. What is inferior adjacent? Inferior adjacent are the levator animuscle, okay? The pelvic diaphragm and levator animuscle. So, any weakness in the levator animuscle can downward the ovary and make the prolapse of the ovary. What is prolapse?
Falling down.
Yes, falling down. Okay? Any weakness of the pelvic cavity. Another adjacent. The fallopian tube. The fallopian tube has adjacency to all parts of the ovary except of posterior border and lateral surface. Okay? All of the area except of posterior border and lateral surface have adjacency to fallopian tube.
Lateral posterior?
What?
Lateral posterior.
Just lateral and posterior. Yes.
It doesn't connect to them.
Does not connect to ovarian, to fallopian tube. Yes. The ligaments of the ovary if I have a transverse section, at the level of the uterus. Okay. In the transfer section, posteriorly, I have which structure? Rectum. Anteriorly, bladder. In the midline, yes, uterus, bladder, rectum. So, the peritoneum when covers this structure. In this area, it is parietal peritoneum, and may in the upper part cover the rectum, yes, and arrive in this area. Also, cover the fundus of the bladder and arrive in this area. But in the midline, uterus is an intraperitoneal organ. The body of uterus is intraperitoneal organ that attached to parietal peritoneum laterally. Okay, attached to parietal peritoneum. Where is the location of the ovary? Ovary is an intraperitoneal organ. All the surface and border of the ovary are covered by the peritoneum except of anterior border. Okay, so if they are the ovary, like at here, if they are the ovary in this area and in this area, I say that it is an intraperitoneal organ, yes? So all of this area are covered by peritoneum except of anterior border. It is anterior border. Okay? It is anterior border also in this area. Okay? Anterior border is the site of attachment of this ligament. They are parietal ligaments. Okay, they are parietal ligaments, two folds of the peritoneum, two layers of the peritoneum that attach together and make this ligament. Okay, what is the name of this ligament? Broad ligament. Broad ligament is a ligament which is derived from the peritoneum, attached to the lateral border of the uterus and travel laterally to arrive to the lateral part of the pelvic cavity. When arrive to pelvic cavity, these two layers separated from each other to make parietal peritoneum. Okay, so this is named broad ligament. This ligament, which is derived from posterior layer of broad ligament. Okay, it is posterior layer of broad ligament. It is named mesovarium. Okay, mesovarium. Mesovarium connect posterior layer of broad ligament to anterior border of ovary. What is the function of mesovarium? The function is to travel the ovarian vessels, artery, and nerve, okay, into the ovary. Okay, into the ovary. And another ligament, look at here, inferior pole of the ovary attached to another ligament. Look at here. Look at here. It is ovary. It is inferior pole. Yes, it is a fibromuscular ligament. It is not a peritoneal ligament. It is a fibromuscular ligament which attach inferior pole of the ovary to lateral side of uterus. It is named ligament of ovary. Ligament of ovary. Another ligament. Look at here. In the upper side of the ovary, these two layers of peritoneum travel superiorly and made another ligament in this area, which is named suspensory. Okay? Suspensory ligament. What is the function? I go to another slide. Look at here. Look at here. It is suspensory ligament. It is the continuation of the broad ligament, okay, at the upper pole of the ovary, which made a space, made a route for the ovarian artery and vein. Ovarian artery and vein, they originated from abdominal aorta, yes? Travel inferiorly, arrive to suspensory ligament, okay? They arrive to suspensory ligament. After suspensory ligament, arrive to broad ligament. Arrive to broad ligament. After broad ligament, arrive to mesovarium, and then arrive to the ovary. Okay? It is the root of the ovarian artery and vein through these ligaments. Here we have another name and terminology. Look at here. All of this is broad ligament, yes? Some part of the broad ligament which is located between uterine tube. It is uterine tube. Uterine tube is intraperitoneal or retroperitoneal? Intraperitoneal, yes. The broad ligament at the superior border covers the uterine tube. Okay? So, this part of broad ligament, which is
I think
located.
all of the reproductive tract of the female is intraperitoneal.
No, not all of them.
What?
No, not all of them. Because the cervix of the uterus partially is intraperitoneal, some part is retroperitoneal.
Posterior surface.
Yes, I will teach you. I will talk about it. This part of the broad ligament, which is located between fallopian tube and ligament of ovary, is named mesosalpinx. Okay, mesosalpinx. This part of the broad ligament, which is located between ligament of ovary and the uterus, is named mesometrium. Okay, so mesometrium, mesovarium, mesosalpinx, all of them are derived from broad ligament. What is the function of broad ligament? Which structures are located in the broad ligament? Yes, that's it.
Also the fallopian
Uterus?
tube.
The,
Fallopian tubes.
yes, fallopian tube.
And the
Vessels.
ovaries.
No, not ovary. Not ovary is not located in the depths of the broad ligament.
Ureter? Ureter?
The ureter in the, yes, ureter, but ureter is retroperitoneal, okay? But partially ureter is covered by the broad ligament. This structure are located in broad ligaments. Mesovarium, mesosalpinx, suspensory ligament, I talked about it, ligament of ovary, also I talked about it. Blood supply. The main artery of ovary is ovarian artery. It is just like the testicular artery, and it originates from the abdominal aorta. Another artery which participates in supply is uterine artery. Uterine artery is a branch of uterine artery is a branch of
Internal?
internal iliac artery. Yes, because uterine artery is located in the broad ligament. Okay, anastomoses to the ovarian artery. These two arteries can supply the ovary. What is the venous draining? Ovarian vessel. It is like testicular vessel. In the right side, drain to IVC. In the left side, drain to, yes, left renal vein. What is the lymphatic vessel? Like the testes, pre-aortic and para-aortic lymphatic node. The innervation, it has sympathetic and parasympathetic. Okay? Parasympathetic are derived from splanchnic plexus. Splanchnic plexus is derived from S2, S3, and S4 spinal nerve. Sympathetic is from T10 and T11 of the spinal nerve. What is the function of sympathetic in the ovary or any part of the body? What is the difference of sympathetic and parasympathetic?
Sympathetic should cause vasoconstriction.
What? Yes. Which dilation? Vasodilation.
Vasodilation.
Yes. The parasympathetic made the vasodilation. Sympathetic made vasoconstriction. Okay, vasoconstriction. But in the fallopian tube, the sympathetic can also stimulate the peristaltic movement of the fallopian tube. Okay, in adding to vasoconstriction.
It's to push the egg. Yeah.
Yes, yes, yes. To move to the fertilized egg. Ovarian prolapse, I said that it is occurred when the pelvic floor is weak. The what? Yes, the water on muscle. Ovarian displays which where they can be. It is vaginal. Ovarian displays in the here, the pouch. Look at here. We have two pouches in this area. A pouch is located between bladder and uterus. It is located uterine pouch. This is located between uterus and rectum. It is rectum uterine or pouch of Douglas. Yes. Okay, uterine tube. Uterine tube is an intraperitoneal organ which its length is about 10 centimeter and attached to the lateral side, lateral border of the uterus and travel laterally to arrive to the ovary. Look at here. It has four main parts. The first part, which is located in the depths of the muscular layer of the uterus, is named intramural part. Okay? Look at here. This part, which is located in the depths of muscular part. It is named intramural part. After intramural part, here we have isthmus. Isthmus is medial 1/3 of the uterine tube. Medial.
Doctor, could we increase the size?
Yes, yes.
No.
Okay. Right there. Right.
الهام ما قدرت تظبطها.
ها؟
الهام زور الثمبرة ما قدرت تظبطها.
ما تتزوج ما تصير. غير بس المشي. ها؟ بس
تصير بس لازم نجيب نحن واحد أتقل من الهام تظبطها. معنا احنا أتقل من الأس.
Look at here. It is ovary, uterine tube. This part was ovary. This part is named intramural. Okay? This part, one third, is named isthmus. Okay? This part is named ampulla. Ampulla is a dilated part, which is the main site for the fertilization. Okay? Ampulla. After ampulla, yes. Here we have infundibulum. This area is infundibulum. Infundibulum. Which infundibulum made the fibria? The fibria does not directly cover the ovary. Okay? But one of these fibria, which is named ovarian fibria, at the 14 days in the cycle of the woman, at the 14 days, it grows and make an attachment to the ovary, okay, which it held to the egg to insert to the fallopian tube, okay. The blood supply of the ovary, of the oviduct, fallopian duct, uterine duct, fallopian sulcings, all of these names are related to the uterine tube. Okay? What is the artery, the blood supply? Uterine artery and ovarian artery, because it is located between ovary and uterus. What is the venous draining?
Same as
The same, yes. What is the lymphatic draining?
it's parallel to the arteries.
The lymphatic draining is different. This part, lateral part, drain to lateral part, it is near the ovary, drain to para-aortic and para-aortic lymph node. Okay? Lateral side, because it is located near the ovary, drain to para-aortic and para-aortic lymphatic nodes. Medial side, because it is located near the uterus, this part, drain to superficial inguinal nodes. Why?
It's because it's near to the inguinal canal.
I see you in the picture. When I say, when I talk about the uterine ligaments, I say you that why this part are drained to the superficial inguinal nodes. What is the nervous innervation? Sympathetic and parasympathetic. Sympathetic from T10 until N2. T10, N2. Parasympathetic is from the vagus nerve and the splanchnic plexus. Okay? Vagus nerve and splanchnic plexus. Then, splanchnic, S2, S3, S4. Splanchnic plexus. What? Sorry. Yes, go. Okay. Splanchnic plexus and also vagus nerve. Vagus nerve is a parasympathetic nerve. Yes. These two parts made the parasympathetic innervation of the oviduct.
Well, the sympathetic, the same sympathetic of the
No,
sympathetic.
I said that sympathetic.
Sympathetic of
Sympathetic T10
Okay,
until
but splanchnic or what?
splanchnic plexus are derived from S2 to S4, which are parasympathetic
Only?
part. Only, yes. It is only parasympathetic part, but in the pelvic cavity, the parasympathetic part attached to sympathetic fiber and made the hypogastric plexus. Okay?
It's very unfair.
Yes. When they merge together, made the hypogastric plexus. Which hypogastric? We have inferior hypogastric and superior hypogastric. Salpingitis. Salpings means tube. Okay? Salpings means tube. Fallopian salpings means oviduct or uterine tube. Salpingitis means any inflammation in the oviduct. Okay? Another name is tubal blockage. TB, tubal blockage, is occur when any inflammation made the constriction in the tube. This inflammation can be congenital or can be acquired, okay? Because of any bacterial or fungi inflammation. Or also it can be congenital inflammation. What does it do, the inflammation? It prevents to fertilization, okay? The released egg cannot arrive to the spermatozoa. So here we have a test which is named Robin test or insufflation test. In the insufflation test, okay, the egg is pushing to the uterus. The egg is pushing to the uterus, travel to the vagina, arrive to uterus. After arrive to uterus, arrive to the oviduct, and you can hear the whizzing sound in the peritoneal cavity. You know that peritoneal cavity in the man is completely closed, but in the woman, peritoneal cavity, it is not completely closed, okay? It has a direction to outer of the body through this area, okay, through the oviduct, because I said that this female does not completely cover the ovary. They are free.
The anterior surface not covered.
No, here, I am talking about the peritoneal cavity. The peritoneal cavity, here is the vagina, yes? The peritoneal cavity has a direction to outer of the body. During insufflation test, you're pushing the air in this area, and if this direction is free and you don't have any tubal blockage, you can hearing the sound of the whizzing in the peritoneal cavity because this air arrives to peritoneum. But in the man, the peritoneal cavity is completely closed. Okay? Another test is hysterosalpingography. Hysterosalpingography, you insert a dye in the vagina and in the uterus, and this dye is split in all this area. After a scan, you can see that the oviduct is blocked or is open. What is tubectomy?
Cutting and type of
Why you do tubectomy?
Removing.
For sterilization of the
Yes, for the sterilization. Uterus. The uterus or the womb is located in the median part of the body between rectum and bladder. The uterus has this part.
Dr. Street. Doctor,
What?
is it possible to take 10 minutes?
10 minutes question.
Thank you.